Decompression table was recommended to me by my primary. She recommended Scott Banks, and I really feel it's been helpful. It's taken a lot of pressure off my upper back.
You've been coming to Dr. Banks for how long?
A couple of years now.
Okay, and you initially came for what?
I came because I had chronic problems with my neck.
I used to slouch even when I'm sitting here. If you can, I think I'm sitting up more straighter than I normally would. Normally I would be a little bit like this. So it is working, and I do believe it's part of the decompression part of it and the actual, chiropractic part of it, or both of them combined. I don't know, but definitely the way I walk, the way I feel, as far as structure-wise, definitely feel a difference.
And you originally came to Dr. Banks for a couple of things, but for low back pain.
Mm-hmm.
And we decided to use the antalgic tract lumbar spinal decompression for your treatment.
Mm-hmm.
Describe the antalgic tract and what it's done for you and how it's helped you.
Well, after 24 years of physical therapy with lower back pain, I just learned to live with back pain on the L5 neighborhood there. And I was told my disc was basically not very happy anymore. And from the education from you of what decompression was all about, you put me on a table, and actually I felt pretty good going home that day. And if you remember, I called you from my office that I was not actually in pain anymore that day.
For the first time in how long?
24 years.
Okay. And how's this different than anything else that you've tried?
In a word, it's basically you're just pulling the spine and decompressing all the nerves in the spine there, whereas physical therapy did other things, just not that.
I herniated a disc in my back, and I was very uncomfortable, and conventional medicine was giving me pills that really weren't working.
What does the treatment entail?
Right now I'm coming for decompression treatments, and I've also come for adjustments.
And you find that the combination of the chiropractic adjustment and spinal decompression for your neck is beneficial for you?
Yes, it has helped.
Great. Would you recommend that for other people?
Yes, I would.
Is the decompression painful at all?
Oh no, it actually feels very good and residualizes for the whole week. It's awesome.
Now, how often do you come in at this current period?
Every Wednesday, once a week.
Okay, and how long are you on the table for?
2.5 years.
And what's the period of time that you're being decompressed?
20 minutes.
Recently, I know that you had a workman's compensation injury when you were hurt on a truck. And since that period of time, you've been using the antalgic tract, the spinal decompression table. How's that working for you?
That's probably the best form of therapy I've had so far. Between what the doctor prescribed, what Dr. Banks prescribed, I get, without question, the most relief from that.
And the main reason why you came to see Dr. Banks?
I had a severe back pain, lower back pain.
And that was a result of what?
A car accident.
And prior to seeing Dr. Banks, what other doctors did you see?
I went to physical therapy for about 6 to 7 months, and I was referred by them to an orthopedic doctor to get epidural shots.
Right, and the epidural shots, you decided not to go that direction,
I
right?
refused, yeah.
And what's your number one hobby?
Cycling.
And I think what initially brought you to Dr. Banks' office was what kind of issue?
Lower back pain.
What kind of procedures do you have in the office here? What happens to you when you come in?
Okay, I started with getting adjustment and the heat and stem therapy, which was very, very helpful. But a couple of years ago, I have 3 herniated discs, and the adjustments were helping, but not to where they needed to be. So Dr. Banks suggested decompression might be a solution. And 2 years ago, I couldn't walk, even with the adjustments, I could no longer walk in December for 3 weeks. And after that, in bed for 3 weeks, icing it up, I went for the decompression. And it really has helped me out tremendously over the past 2 years.
The decompression table has been great for me. It has really given me some relief and helped me with my headaches tremendously.
And then you were told about a technique known as spinal decompression, that Dr. Banks has a very unique piece of equipment.
Correct.
And how did that work for you?
My first time on the chair, I saw a huge difference in the pain in my back.
And now you've been coming for the last 4 weeks, and how's your pain currently?
Before I was on the table, it was about, from a scale to 1 to 10, I would say about an 8. Now it's about a 4.
Great, so you're making nice improvement.
Yes.
Tell me about your experience. How'd you come to Dr. Banks' office?
Oh well, I had a car accident. Somebody hit me in the back, and while I was actually stopped by the red light. As a result of my car was damaged, and then myself, I had a back pain and the neck pain that I had as a result of the injury.
And we put you on the antalgic track, the lumbar spinal decompression table for your lumbar spine. And how'd that work for you?
Great.
You want to just describe that treatment, what it feels like?
It just stretches out your my spine, and just felt like it was taking the pressure off of my spine. And for instance, when cycling on longer rides, my lower back was always bothering me. And after a few sessions on that and just getting adjustments, I don't feel the pain anymore.
Because we saw positive results on the MRI for disc injuries, we decided to do the antalgic track cervical decompression table.
I see.
How's the decompression table working for you?
Well, the table is doing very good. It's been nice. It's a good experience because I haven't had anything like this before, and it's helping me quite a lot about pains, especially on my neck.
Is the decompression painful to have it done?
Well, not to me. I don't think so. But I think it's a good exercise because certain pressures and nerve pressures that I come across, as a result of the machine. It's been very good. It's been a good experience.
And would you recommend decompression for anybody?
I would so, yes, because it's a nice technique. Sometimes the hands don't do things as a machine does, so I think it's better.
And do you want to describe the treatment? What's a session like on the antalgic track?
You get on the antalgic track and you're strapped in so that only the part you need moves, and then the chair does all the work for you. And just getting your neck work done, it's amazing how many spots of just proper neck movement with a little bit of pressure you feel it in.
Is the technique painful at all?
No, not painful in any.
Do you feel better after you've come off the table?
Without question. There's nothing I've found so far that works better.
And is the decompression table like anything else you've ever been on before?
No.
Would you highly recommend that for somebody that's been with low back pain for a long time, that maybe is looking at having surgery or living on medications or always in pain?
I come because I was very sick, it bothers me in the back by osteoporosis, and I prove that better, I feel better, and every time I come here, so, and I like to continue until,
I came up where my back was really bothering me. I went to an orthopedist, I went to a couple of people, the x-rays and MRI showed that I had a desiccated disc in the bottom.
One visit with the doctor, one adjustment, and I was pain-free. And I've been coming steadily ever since then. And I really don't need any pain medicine for my back, which makes me happy. I don't have to take any meds with side effects and that.
I remembered what Scott did. I came to visit him, and he has this new machine, this deep compression table, and he's relieved that area by opening it up. It's stretching, allowing the energy in the blood and everything to get back in there. And it has really worked wonders for me.
You've had shots in your back. You've had
Right.
epidurals, right?
yes, 2 times,
2 times.
Yes.
And they helped a little bit, right?
yes,
Good. And now you go on the antalgic track, the spinal decompression table.
right.
And how does that feel?
I feel great.
And how often do you come in now for decompression?
The compression, I come about every month now.
Is it comfortable?
Yes.
And what led you initially to come to see Dr. Banks?
I originally came to see Dr. Banks because I had some back problems.
Okay. And I remember correctly, did you have a mountain bicycle accident?
Yes, a few years back I had a mountain biking accident where I fell on my head and herniated a number of discs in my neck, and I've been getting treated by Dr. Banks on the traction table for a number of years since, and I find that if I don't do that, the pain comes back and it helps me maintain so that I can avoid surgery.
On a scale from 1 to 10, if 10 being the worst, I say my pain was a good 8 or 9, and now it's about a 2, you know, so it's really relieved. The fact is when I feel it, I have a source to go to relieve it.
I was going to regular chiropractic, and although it would help me for a day or two, there was no longevity to the way I was feeling. So it would help me for a day, 2 days maybe, but I was really never able to feel much better.
Do you find the cervical decompression to be painful or painless?
The cervical decompression is totally painless. It's actually quite relaxing. I actually sometimes fall asleep. I meditate and find it really very relaxing.
Okay, and would you recommend this procedure to other people?
I would absolutely recommend it.
I believe you were on the table for approximately 15 to 20 minutes for each session.
Yeah, my guess is about 20 minutes a session, tops.
And we do about 2 times a week for you currently.
Yeah, 2 times a week.
Would you recommend this technique, the intelligent tract spinal cervical decompression, for patients with cervical disc problems, cervical bulges, cervical stenosis, any type of cervical neck pain that somebody might be looking at having a surgery or epidurals, or they've been living in pain or on drugs for a long period of time?
I'd recommend this over any of the other choices you mentioned. Just, if you don't have to be cut open to get fixed, or take drugs to be fixed, which doesn't work anyway, why wouldn't you? I've recommended this to anyone I can think of.
And how's the chiropractic adjustment been for you over the years?
I've tried 3 other chiropractors and I'm staying here.
On a scale of 0 to 10, what was your pain level when you initially came in?
10.
And how are you feeling now?
I had like 1.
Great. And would you recommend decompression for
Ab-
somebody
absolutely.
that's thinking about having disc surgery or epidurals or a lifetime of painkillers?
I would 100% recommend this before anything.
I think people are skeptical because of the way they think. They think that they need to approach it from a traditional Western medicine of give me some kind of a drug, I need to get rid of this right away. But it's, you know, with Scott, obviously, he approaches it from a more holistic standpoint.
From my experience, Dr. Banks has been very good with adjustments of the back. I've been pain-free, and it's improved my posture, made me much more comfortable.
Once I got over the initial healing, it's really been, I have no problem. Now, I'm a musician, so, you know, I've spent a lot of time sitting down on a drum stool, and that has probably added to this spinal compression. And, but with Scott's method, you know, as far as the decompression table goes, it's been really helpful for me.